What is the success rate of disc replacement surgery? Well, there's two types of disc replacement surgery. Cervical, success rates are extremely high. It's well published, 93% to 95%, and they were studied next to fusions. You can read my papers on it, other guys' papers on it, comparing two-level fusion to two-level disc. Every outcome measure is superior with artificial disc, with pain scores and neurologic outcome. All of them are superior in every study published, really. It's not refutable. In the low back, it's also very similar. Superior outcomes in general. Some studies show it has parity or equality with back pain, but in my personal experience doing this, most patients have superior pain relief with artificial disc, and I can tell you from my personal experience having fusions, which hurt way the heck more than my artificial discs ever did. So, and my patients all seem the same way.